Hi, I am here. I'm so excited with Dr. Lisa Palmer-Olsen. And Lisa, I just want to remind people of some of your background, going all the way back to in your doctoral program, doing research on same-sex couples dealing with trauma. Your dissertation, if I'm remembering right, was on a supervision with emotionally focused therapy. Is that correct?
How to teach EFT in the way that could be most integrated and most simple for people.
Yes. And I think about when I met you, and you'd already been training quite a while because you've been teaching and training EFT, I think, for almost 25 years. And one of the things that struck me was people have to have an experience. You used to say, we've got to get people down in the work. We've got to get them role playing, feeling it, and doing the work. And I think if people don't know Lisa's work, one of the things you've done is you've carried through on that dissertation, and you've
Hmm.
been supporting supervisors all around North America and the world in how do you help people fully engage in emotionally focused therapy as a person and as a vulnerable activity. And I think you excel at identifying where people pull back and start thinking it must be the model's limitation when really there's something in us getting stirred up.
Yeah, the whole person, right? The
Oh,
whole person of the therapist is really primary to learning this model. It can't just be top down, taught in
right.
that way.
Yeah, I think you're the first one I heard say, like, you have to have a bottom up experience that then you can make sense of in a top down way. But if you just keep making sense of the top down, you'll never really feel the model. Can you tell us a little bit about family therapy? Lisa, Dr. Lisa Palmer-Olsen and family therapy.
Well, the most exciting part to me is thinking systemically and being able to understand there's a process happening in a family system just as much as one that's happening between two caregivers in the couple model. And the the thing that really stuck out to me around moving into the family model is when I would be finished closing with the couple, bringing in the kids, bringing in relationships that are within their family of origin, and the model started moving into preventative model for me. The family therapy work is for me the same as working with the couple because I was trained initially in systems thinking. So obviously working with the caregivers and getting that process secure is going to impact the children. At the same time, when we're finishing with the couple, to be able to bring the whole family in and have deeper, more vulnerable conversations where kids can actually say what they're feeling and ask for what they need and send more clear signals, it gives the caregivers a better chance at providing a secure platform for the kids to launch. So bringing those kids in and having those conversations has really been meaningful to me because I can see without doing that, we would have missed a lot of areas. And so the family therapy piece is so important and valuable to add to our couples work. It's just a nice outgrowth of the couple work.
Yeah, I think you call
Bring
this,
something different.
um, you call it step 10.
Right. Yeah,
Kind of
it's
this,
a little joke that I had with Sue. Like, I think there's a step 10. I think it's bringing the kids in, regardless of age, that it turns the model into preventative model versus intervention. That it doesn't have to be at distress that we come on the scene and organize things and help people shift and change processes between couples. But also, how can they pay it forward and bring their kids into what they're doing differently so that their kids can recreate that in their own relationships in the future.
wow, that is super powerful. So right there, one really, I want to reflect back. So if I'm watching this video, I'm thinking about coming to see you in the fall in Boulder, that how much your systemic thinking is integrated, right? It's so
Mhm.
integrated that you found yourself gravitating towards, why just stop here with the couple and the parents? Let's get the kids in here. Let's let the children be seen and heard and held. And like you said, learn to send clear signals. Um,
And be
so
committed to that, right? Taking it one step forward, it shifts the next generation, right? We don't have to wait for that particular child to act out or show symptoms, right? Bring them in and have the parents have a single parent talk about how hard it's been, but they want to give space for them to share how they're feeling and do things differently.
Well, I'm gonna, I do a lot in the addictions field, and I just had this image of, say, the young person's 14, and if they work with the average couples therapist, they do some work together, they get stronger, but we don't bring that 14-year-old in who's maybe struggling. The parents are often the last to know. If they're seeing Lisa or someone trained and inspired by Lisa, maybe they work with that 14-year-old who surfaces some depression, some anxiety, some dabbling with pot or something at a young age that could lead at 16 or 17 to a out of the house residential placement and chaos.
Right.
So that's
Well, and if the couple's getting into therapy, they have distress at the top, right, in the hierarchy. And so there is a level of disengagement as they're working through and past whatever it is that's caused conflict or distress in the caregiving system, right? So it just makes sense naturally if there are children involved, or if there are older kids even, that there's been some level of distress, if you think systemically, that's hit the sibling system, regardless of age. So even having that one conversation, I mean, we had a grant at UCSD to do couples therapy to try to work on reducing the divorce rate at diagnosis with couples that the very high divorce rate among intimate cancers at UCSD. And I said, let's do this. Let's continue to move this into like step 10. So as we're working with these couples and trying to decrease the divorce rate at first diagnosis, I'm saying to all the doctoral students, bring in the kids. If there's kids, bring in the kids, because imagine you have cancer, you're suffering from cancer, you're in chemo, your partner is also struggling. There's distress. There's not necessarily a relationship conflict, but it becomes a lot of distress for everybody to be the caretaker, to also go through the cancer process. You're potentially threatened. Your life is threatened by this. The kids are going to feel that disengagement just by mere survival, right? So we brought in a 12-year-old once, very similar to the example you gave. His mom was struggling with breast cancer. Dad was exhausted, working both like 2 jobs, plus taking her back and forth, supporting her through chemo. We brought in this 12-year-old. He was hours away from taking his own life, because what he said was he lost both his parents, and his mom is going to be dying, but he's actually going to lose both, because he sees his dad going down and not able to even wake up and help him in the morning. And he was a 6th grader, and we got him into treatment right away. He's written us since then. Like, we would have never thought to bring in, we're dealing with this couple that's dealing with a life-threatening issue, having distress and feeling like there's been abandonment issues through the process, and hoping to prevent them from divorcing. And we just said, this is what we're doing as part of our protocols. If there's kids, bring them in. We bring this kid in, and he was so depressed and would have just been overlooked. Not because the parents don't love him. They were just at their last, I mean, literally last, bit of energy surviving cancer and the treatments. So to think systemically and to get people inspired to bring in the whole family system and to see what can change, because families move fast. Families change fast. They change a lot more quickly than couples process changes, right? There's something about the biological underpinning, with a caregiver to a child that just pulls upon this network of attachment a lot easier to get to, out of rigidity into flexibility.
That's right.
Faster. Right. So it's pretty powerful how you can move from stage 1 to stage 2 within 2 sessions.
Yes.
Right. With a caregiver, because you're plugging into something that's just hardwired, truly hardwired biologically for this parent to care. So the minute you pull that dad towards his child, seeing that his child is also suffering and that he can do both. He has a wife who's possibly dying of cancer, and a son who's now suffering. When you put that caregiving place back into focus, right? The dad responds within 20 minutes.
That's right.
The mom doesn't have the energy, but she's tearing up and saying, I love you. I need you to be here for me. right? And I need you to stay here with your dad. And this young man gets the support and love he needs, like within 20 minutes, and a
Mm,
life-changing decision, right? Life-changing decision he's able to make, that he wants to stay alive,
yes,
right? Just from that one thing of just like bringing him in. So it just feels so important. I want people to be engaged in that way and want to learn how to work in this model, because really it's Sue Johnson's EFT couple work that is systemic work.
right,
It is including the kids, and it becomes prevention,
yes.
right?
It's an expansive view. Yeah, I flash on so many families when you said that, how change and getting into these deeper attachment emotions. And if you look at a family from a caring, strength-based place,
Right.
from days back in like Denver Children's Home and the Tennyson Center,
Mm-hmm.
when I first got out of grad school and could see the scolding and correcting and
Right.
things, families versus resourcing them by
Right.
them towards each other. And you said a couple of times thinking systemically, but in closing this clip, I think what you're doing is feeling systemically, right?
Mm-hmm.
And inspiring all of us to bring our hearts in and ask these questions. But who else in the family can benefit from EFT and attachment work?
Right. And I think people are afraid sometimes of bringing the whole family in, and it feels scary. And I think what the training can bring is organization and like a map,
Mhm.
right, of how to handle multiple dyads and multiple systemic processes happening at once.
Right,
But if you can sort that out, it's so much easier. Family therapy is so
right.
much easier than couple work, because you have this piece you can rely on that's just
Mhm.
there. They don't choose to, they obviously have a child, but they're not choosing that child. Whereas you have romantic partnerships, they can choose to leave, right? There's a piece that's in family therapy that you can pull on that you can't get from couples.
That's
But
right.
people, I think, are intimidated by the high escalation and the multiple processes happening at once. But we have a way to manage that so you can find your center and a map so you can make the most impact in the future generations.
It's beautiful. Maybe can we do another clip in a bit about the E.F.F.T collaborative and
Hmm.
how E.F.F.T has been
Sure.
developed as a model. Thank you, Lisa. To everybody, she's coming in September and October. Is it?
I don't remember the
Boulder.
dates. Might
Well,
be changed.
but you go to the Boulder EFT community, you can find out.
Yes.
And I
Yes.
share this. I'll put the link. I'm looking forward to hearing you talk about family therapy for a couple days. Thanks, Lisa, for your time.
Thanks, Jim.